If you need assistance on the call, please press star, then 0. There will be a question and answer session. During that time, if you'd like to ask a question, press 1-0. At this time, I'd like to turn the conference over to Supervisor Kathryn Barger. Please go ahead.
Thank you. Good afternoon. I'm Supervisor Kathryn Barger, Chair of the Los Angeles County Board of Supervisors. Thank you all for joining us here today. We are here to provide our daily briefing on the county's response to the coronavirus outbreak. The situation continues to change daily, and as such, government and community leaders are continuously responding to help protect the public's health while supporting everyone's emotional well-being. After we hear from Dr. Barbara Ferrer, we will also hear from Sky Patrick, the county's librarian, who will speak to us about programs that they are offering. The various measures implemented by state and local government to contain the spread of COVID-19 has had a tremendous impact on our daily lives. It has resulted in school closures, the cancellation of recreational programs and sports activities, and the closure of beaches, parks, and our trails. In addition, our libraries, like all others throughout the county, were forced to temporarily close their doors. It was a difficult decision, as I know what an important resource local libraries are to our residents. We are here to tell you that Los Angeles County Library has built programs and services that extend far beyond the traditional book loans. And moving beyond their physical walls, they have developed countless resources that are available to our residents regardless of where you live throughout the county. Sky is going to speak in more detail about these programs, but I implore you to please visit the library online and consider participating in a program or activity that you may not have thought of otherwise. Whether you have children and are looking to engage their young mind, or you are an adult at home and want to learn something new. Exploring new opportunities, including those available at the county library, can help each of us grow and develop through this experience. In addition, the resources provided by the public library, the county has collated other resources to support our residents, young and old alike. These can be found at our county website dedicated to the coronavirus, which is lacounty.gov/COVID-19. One last thing I would like to mention before I close. I applaud individuals who have been diligent about wearing gloves and even masks when they are shopping for groceries and running essential errands. However, we continue to notice littered gloves in parking lots and along sidewalks. Let's stay proud of our neighborhoods and our communities and keep our streets and sidewalks clean. Please throw your gloves in the trash. I want to thank you all for your continued support as we navigate this crisis. And with that, I would like to invite Supervisor Hilda Solis, Chair Pro Tem, to say a few words. Thank you, stay safe and stay healthy.
Thank you, Chairwoman Barger, and good afternoon to everyone. I want to take this opportunity to thank our county family and our public-private partnerships that we have established in the last few weeks and months ahead for helping us move along to combat the coronavirus. As we enter into another week of physical distancing and staying at home to save lives, I really want to thank all of the public. I want to thank those for continuing to do your part, but we have to do more. There are so many people who are making enormous sacrifices each and every day who are putting the public interest above their own. We see you and we thank you. Today I want to focus on the efforts in the 1st District to address the issues of COVID-19 testing, increasing hospital capacity, and food security for our residents. The drive-through testing site at the Fairplex in Pomona came online, as you may know, last week and has the ability to test up to 250 people per day, 7 days a week. To date, 750 people have been tested. And I'm happy to announce that another drive-through testing site will be up and running at East Los Angeles College by tomorrow. This is an exciting partnership between the county and our staff, East LA College, the Roybal Comprehensive Health Center, and it will serve a much-needed testing site in East Los Angeles as well as the San Gabriel Valley. Testing will also be free for everyone. our seniors and people with underlying health conditions will be prioritized. So please visit coronavirus.lacity.org testing or call 211 to determine whether you are eligible for a test and schedule an appointment. And of course, we're looking at many different sites to ramp up our testing capacity. By the end of the week, I'm hoping to finalize our partnership with Altamed and Presbyterian Hospital, two leading healthcare providers, to increase testing capacity at their locations in Southgate, Commerce, Pico Rivera, and West Covina. This partnership will allow us to build upon testing capacity in the East Los Angeles area, Southeast Los Angeles, and San Gabriel Valley communities. As you can see, we're approaching testing through a regional lens that prioritizes equity. That means that while not every city will get a drive-through testing site, we're ensuring that there is testing capacity in every region of the county. And I'm also concerned about the reports coming out of other cities that show significant racial disparities in COVID-19 cases and fatalities. We must collect better data to identify and address the disparities in LA County. And just as important as testing is our hospital capacity. Governor Gavin Newsom announced yesterday the transformation of the St. Vincent Medical Center into the official Los Angeles Surge Hospital. It's going to be a temporary facility that will provide relief to our existing hospital system to the tune of more than 250 beds. St. Vincent Medical Center is located right in the heart of the 1st Supervisorial District, and I'm proud that it will be there to help save many lives. I want to thank the governor, I want to thank Kaiser Permanente and Digni Health for this bold action. And under our direction, our Department of Health Services will provide the necessary support to get this facility online as soon as possible. It is an innovative partnership like these that can keep our hospital system from being overwhelmed, saving lives in the process. As we surge our hospital capacity, we need to also increase our staffing capacity. This means we need more people power. We need more healthcare and medical professionals, including medical and nursing students, to sign up to work with the county. And given the diversity of Los Angeles, we need more people who can speak multiple languages and can deliver culturally competent, appropriate healthcare. Our local communities need care from physicians that come into our system. We need you to know now more than ever, so please visit California Health Corps website at covid19.ca.gov/healthcorps to begin your application, which could help to save many, many lives. And lastly, as we know, these are difficult times, but it's even more difficult for our constituents who are struggling in food insecurity. This is why we have the Sowing Seeds of Life drive-up food pantry at the Pomona Fairplex, as well as one in South El-Monte. Please call our San Gabriel Valley Service Center to find out more information at 626-575-5431. And we're looking to stand up other food pantry sites in the region. Please visit lafoodbank.org to find a food pantry near you. In conclusion, I'll end by saying that while there's signs that the physical distancing measures are yielding results, we must not be complacent and instead work even harder to flatten that curve. And let's stay home and save lives. In the next 2 weeks, it's crucial, and we're counting on you. With that, I am now pleased and honored to introduce Dr. Barbara Ferrer, our Director for Public Health.
Good afternoon, everyone, and thank you, Supervisor Solis and Supervisor Barger, and all of our colleagues across the county. The leadership and collaboration during this unprecedented time is deeply appreciated by all of us. I want to update you on our current status. We're sad to report an additional 22 deaths today. 16 of the people who passed away were over the age of 65. And all of those people who were over the age of 65 did have underlying health conditions. The other 6 people who died were between the ages of 41 and 65, and five of these people had underlying health conditions. This brings to the total number of deaths to 169 in Los Angeles County, and our mortality rate for COVID-19 continues to creep up slightly and is now at 2.4%. Today, I'm also going to be reporting some preliminary race and ethnicity information for individuals who have died who were positive for COVID-19. I want to underscore that this data is preliminary because fully 43% of the people who passed, we do not yet have information on their race and ethnicity and are working hard to be able to complete those records. For the 93 deaths where we do have race and ethnicity information, 19% of the people who passed away were Asian, 17% were African American, 28% were Latinx, 27% were white, and 9% were identified as belonging to another race or ethnicity. When we look at these numbers by the total population of each group, African Americans have a slightly higher rate of death than other races and ethnicities, and we will be watching this closely as we gather more information about the remaining 43% of people who have passed away. I want to encourage providers, facilities, and labs to please collect and report race and ethnicity data so we can better understand the burden of disease across different populations. And so many people in our community are grieving the loss of a loved one from COVID-19. So please join with us as we mourn their loss and keep them in our thoughts and prayers. Today we're reporting 550 new cases, which brings the total over the last 48 hours to 970 new cases. There are 6,910 total cases across the county. These cases include 230 individuals that were reported by our partners in the city of Long Beach and 72 cases reported by the city of Pasadena, both which have independent city health departments. We're also confirming 10 cases amongst people experiencing homelessness. One case under investigation is a person who may have resided in one of the city shelters. 78% of all of our positive cases continue to occur among people between the ages of 18 and 65. And this number, as you know, has remained consistent throughout, reminding us that everyone has the possibility of becoming infected, although clearly those with underlying health conditions and those who are older have a much more significant chance of having both serious illness and, in fact, dying from COVID-19. 1,510 people have at some point been hospitalized if they've been positive for COVID-19, and that again remains at about 22% of all of our known positive cases. Currently, there are 869 people are hospitalized, and 43% of the people who are hospitalized are over the age of 65, and 18% are under the age of 45. 132 people are currently in the intensive care unit. That includes 53% of people who have underlying health conditions, and 44% of the people who are in the intensive care unit are 65 and older. As always, you can see an updated report of the LA County cases on the Department of Public Health's website, publichealth.lacounty.gov. We currently continue to see significant increases in the number of institutional settings where there's at least one positive case of COVID-19. Today we're reporting that we're conducting investigations in 121 institutional settings. These include nursing homes, assisted living facilities, shelters, treatment centers, supported living, and correctional facilities. The total number of confirmed cases among people and staff who reside in institutional settings is 552. 307 of the confirmed cases are among residents in these facilities, and 309 are among staff. We're sad to report that 37 people who have died from COVID-19 were residents in these facilities. This included people who were residing in skilled nursing, assisted living, and one person who worked in a correctional setting. We're also reporting that there are 30 confirmed cases in jail facilities, and that includes 1 inmate and 29 staff. 10 cases have occurred in the state prison, and that's 8 inmates and 2 staff, and 2 cases have occurred in juvenile facilities. Both were among staff. Among our shelters and interim housing facilities for people experiencing homelessness, we have identified 3 cases. One was a resident at a shelter where we're investigating, and 2 are staff members. We always post a list of all the facilities with confirmed cases on our website once we've notified their staff, the residents, and the families. As a reminder, we are going to continue to see an increased number of institutional settings with positive cases as there's more infected people in our county. And I want to note that our DPH teams work at every single one of these facilities that has a positive case, and that management and staff are doing their very best to protect the health of their residents. Although we don't report on case counts for specific facilities, I want to note that the vast majority, really over 80% of the facilities where we have current investigations, have less than 3 cases. So I want to commend everybody at those facilities for doing their very best to introduce infection control processes that work and make sure that they're isolating and quarantining as appropriate people who reside in the facilities. As of April 6th, over 35,300 people in the county were tested, and 14% of folks were positive. I want to note that we believe we have over 20,000 negative lab results that aren't included here. We're waiting for verification through electronic lab reporting, and hope by the end of the week we'll have a more accurate count of total labs and the percent of folks who are positive. And I want to thank everybody, both our city and county partners who are working so hard to expand testing capacity and opening up sites, particularly in communities that have had less access to testing. We are, in fact, looking at data around testing, and one thing that we know already is that testing is happening much less in communities where most of the people who are living are people who are living in poverty or close to poverty, and that testing access is, in fact, that people who are living in wealthier communities have had, in fact, better access to testing and, in fact, have been tested more than people who are living in communities where income levels are much lower. And we will be producing a complete report on what we know about access to lab testing by early next week. As a reminder, you know, and I thank so much Supervisor Solis and Supervisor Barger for continuing to ask us all to stay home and stay safe. I want to note that as we're all adapting to life at home, it can be very challenging, and I thank all of you for rising to the challenge. But it also can be isolating, and it can create a lot of tension and stress. And I know that many people, all of us, are feeling anxious and somewhat depressed because these are unprecedented times, and it's easy, very easy, to feel overwhelmed. So it's really important that you try to keep your connections, even though we're all at home. Call, email, text, video chat with the people in your life. Reach out every day. It helps the people you're connecting with, and I know it helps you as well. One of the most important pieces around our emotional well-being is being able to feel connected. So let's make sure that no one has to go it alone at these difficult times. And if you're feeling overwhelmed or stressed out and you want to speak with someone, please know you can call the LA County Department of Mental Health Access Center 24/7 helpline at 1-800-854-7771. That's 1-800-854-7771. People on the other end that are happy to listen to you and connect you as appropriate to the services and support you need. And a special note, for those of you who are experiencing violence or the threat of violence in your home, I hope you know that help is available. Los Angeles County's domestic violence services are available, and shelters are open, and they're accepting intakes. Law enforcement is able to respond to domestic violence 911 calls, and emergency protective orders, this is really important, are in fact being issued, and nonprofit legal services are available for anyone who needs help. You can call the domestic violence hotline at 1-800-978-3600. That's 1-800-978-3600, and I know you'll get help and support as you need it. There's also resources at the Domestic Violence Council's website, which is publichealth.lacounty.gov/dvcouncil. This week is Holy Week, and Passover begins tomorrow. And I know it's a time when so many of us want to be with our family and with our faith community. And many faith-based organizations are finding ways to reach out to people online through virtual services, and people are finding ways to practice their faith together from afar. I ask you to share your tips with us on how you're observing these important days of faith on our social media channels. We're on Facebook, Instagram, and Twitter at LA Public Health. We've been hearing that there are some faith-based groups that are deciding that it might make sense for them to plan gatherings of people in the area. And I want to remind folks, although it pains me to say this, that we have to find ways to honor our safer at home order and to be safe while we're together emotionally but apart physically. So that I ask for now that you please cancel any planned gatherings. And this includes in-person gatherings as well as gatherings in cars. It's not really safe to do this, and we ask you to adhere to the Safer at Home order, which prohibits these activities. We do extend our warmest wishes to all who are celebrating holidays this week and next, and we're grateful for your willingness to find new ways to affirm your faith and support for each other. This is the stay-at-home week, and I'm so pleased that so many of you have heeded our call to please try to avoid any absolutely unnecessary leaving your house to go shopping, and want you to take care of yourselves, take care of others by heeding our let's stay at home and prevent the spread of any infections. I hope that we can continue to be kind to each other and to ourselves. And thank you so much for your goodwill and your compassion with each other. And now I'm really pleased to introduce our county's librarian, the director of LA County's Library, Sky Patrick.
Thank you, Dr. Ferrer. Good afternoon. My name is Sky Patrick, and I am the director of the LA County Public Library. Through these unprecedented times, the LA County Library remains committed to connecting with and serving the communities of Los Angeles County. With the support and the leadership of the Board of Supervisors, we are proudly working with our fellow departments to provide essential services to the public. While our doors are closed to the public, I want all county residents to understand that the public library is still here for you. We are open. Online chats, email, and phone for all your reference needs. Our phone lines are available Monday through Friday, 9 a.m. to 6 p.m. For teachers, parents, and caregivers, you can contact our library staff for resources and engagement opportunities and ideas for children who are now being homeschooled. Library card holders can access our collections 24 hours a day, 7 days a week, and have access to all of our free digital collections such as ebooks, audiobooks, music, movies, magazines, and so much more. And for those of you who do not have a library card, we now have an opportunity for you to gain an online library card, which gives you access to all that I mentioned and so much more. Things that you can get from our website: you can obtain free online training in subjects like Office 365, coding, photography, and resume writing. You could also learn to speak a new language in this time. And there are a myriad of other courses, both professional and personal, for your development. For homeschoolers, you should take advantage of our free one-on-one live tutoring and homework help online. It's through a program called Brain Fuse. It's available daily from 1 p.m. to 10 p.m. We have automatically extended all due dates and waived all late fees on items until our libraries reopen. And for our younger children and our caregivers, we now have streaming virtual story time on Facebook and Instagram twice a day, Monday through Thursday at 11 a.m. and 3:30 p.m., both in English and Spanish. We're also starting this week to promote our virtual programming for adults, such as book talks and video tutorials for art projects. Please know that we are still here for you, and we are happy to help you in any way that we can. Thank you. And with that, Ryan, we are ready for questions.
Okay, ladies and gentlemen, if you do wish to ask a question, press 1, then 0 on your phone. Our first question will come from the line of Dave Lopez. Please state your media outlet.
Yes, thank you. Dave Lopez with Channel 2 and Channel 9. Doctor, three quick questions, if I may. The first one is, do you have an accurate number or any number of all, how many people have recovered from this virus who have been sick? In regards to the people who have died, the underlying conditions, is it mostly diabetes, asthma, or something more complicated? And yesterday when you gave your order for people not to shop, was that a blanket order for everyone or just people 65 and older with underlying conditions? Thank you.
Yeah, thanks, Dave. Let me start with the last question. It wasn't an order yesterday. It was, really more of a please do this for everyone's sake. And it applied to everyone. I mean, I had been talking last week a lot about the fact that people who are older and people who have chronic health conditions are at much higher risk of death. And the data is conclusive about this. So, I last week made a plea that all of us really support people who we know in our lives who really should not be going out at all at this point in time. But I also noted that the next 2 weeks are critical here in LA County, and that all of us should avoid shopping as much as possible. If you have what you need at home this week and next week, these are the weeks for all of us to stay home and really try to avoid needing to go out in places where we're bound to come in contact with other people. We're almost at 7,000 cases here in LA County of people who are infected, and that really means that we have significant COVID-19 circulating in our neighborhoods. And the more we can stay apart from each other, the better off we're all going to be. So that was my plea. And then the number of folks that have recovered. This is an interesting number. I just want to go back to what I had said earlier on this, which is when we first started noticing that there was an outbreak in LA County, the guidance was for people to have what we call a cure test. You actually had to get tested twice in order to establish that you had recovered. And there were many problems with that. Amongst them was we had limited testing capacity. The only really advantage of having a cure test that were lab results is we actually could say the number of people who had in fact recovered. We no longer need those lab tests. People recover after 7 days if they've been symptom-free for at least 3 days, fever-free, symptom-free. And we don't have sort of a report-back mechanism. I will say from where I'm sitting, people have recovered once they're no longer in the hospital, no longer under isolation, and have not passed away. And so over time, that number should become clearer to us as, in fact, we see turnaround times at our hospitals, and we can anticipate that many of those people are returning to better health. But in terms of a hard number, we're not going to have that any longer in the way we were able to report it at the very beginning when we had this cure test. And the last question was around underlying conditions. We're trying to do a more detailed report to understand who's in the hospital, what conditions people might have who have been hospitalized, and also to look at information around people who have passed away. But I would say that we're a week away from being able to talk in a meaningful way with all of you about what we're finding. But it's a great question, and we'll get back to you hopefully next week. I'll take the next question.
That'll come from the line of Colleen Shelby. Please state your media outlet.
Hi, thanks for taking my question. Wondering if there are any plans right now for helping people who are immunocompromised or don't have ready access to a vehicle and might not be able to get to one of those testing sites. Are there any plans for shuttles or more mobile accessibility for those individuals?
It's a good question. I don't know that anything special has been set up for one particular group or another. I do know that one of the strategies that we're trying is to have many more sites available where people can get tested so that the distance between a testing site and where people live isn't quite as far. I think right now that, people can certainly look in their cities and see what services are already available to help people who need to get to, for example, medical appointments. So there are some services in some of our cities that actually do provide some transportation options. But I think the goal for us is to make testing more accessible in many more locations so that it's not hard for people who may have either mobility limitations or illness limitations that make it hard for them to get to different places. I don't know if the supervisor or Dr. Gall.
Thanks for the question about transportation. It's obviously very important. I'll note that the Department of Health Services is helping to stand up a couple of the planned new testing facilities over the next couple of days. And DHS does offer avenues for patients to be able to obtain transportation to those sites. All patients who are also eligible for Medi-Cal also have options for non-emergency and non-medical transportation through their plans, and I will verify with those plans specifically about transportation options to the testing sites, but I believe that is also available through that channel. So we can verify that for you in the near future, but certainly if patients are having trouble and need that option, they can contact through the Department of Health Services to get assistance.
We'll do the next question.
And that will come from the line of David Rosenthal. Please state your media outlet.
Hello, thank you. This morning, your office confirmed with us that there have been 4 deaths and 22 cases at the Kensington Assisted Living Center in Redondo Beach. I'm wondering if you could clarify statements you made yesterday about, that tests won't be conducted on a large scale at places where you already believe there's an outbreak. So I'm wondering if we're to assume that perhaps there could be even more cases. I think there's about 100 residents there. And also, what is your message to family members who might have relatives at this or other facilities that have an outbreak? Since in this case, the facility is not communicating with the family, what do you suggest they do? Should they try and remove those individuals to another location, maybe at home where they can isolate? Or what do you suggest? Thank you.
And again, I want to acknowledge and how much sorrow many families are experiencing because the Kensington Center is one of the first places where there was an outbreak very early on. And as you've noted, there's been both a lot of illness and a significant number of people have passed away. In general, we do concur with the advice that's come from both the CDC and the state that if you have a loved one in a facility and at this point in time you're able to care for them at home, it would be perfectly appropriate if you can manage to care for them at home for you to be able to offer that to your loved one. Because many more people are home right now than they would otherwise be, there are families who in fact have those resources and are able to go ahead and make that offer. But I also know there are many families who are faced with the horrible reality that they cannot effectively care for a person in their home, either because they don't have a facility to care for them in their home, they don't have a place to care for them, or because the person requires a lot of care. and that care really does need to happen in our skilled nursing facilities or a long-term care facility. I am distressed to hear that people are saying that the facilities aren't communicating with the families, because that ought not happen. Facilities are, in fact, required to communicate with the families. Families, as you know, cannot visit any of these places where there are outbreaks. There are strict quarantine orders in place, and that prohibits all visitors. But I will go ahead and talk with our team to make sure that we figure out why folks who have loved ones in Kensington are not getting good information, because that doesn't seem right, and we're going to go ahead and follow up on that. But thanks for that. And we'll take the next question.
And that will come from the line of William Lawanese. Please state your media outlet.
Yes, thank you so much. William Lawanese, Fox News. Dr. Ferrer, number one, how do you envision the county reopening? Do you see a blanket lifting of the stay-at-home order, no more social distancing, or something along the lines of limiting social groups to 1,000 or staggering restaurants to 100? And will your recommendation base solely on hospital capacity? And for Supervisor Barger, modeling shows a broad disparity in when states and counties will hit their peak resource times. Do you favor allowing local officials who have the freedom to make that decision when to lift their stay-at-home order? Or do you favor a state or federal decree on this date people can go back to work?
Yeah, it's a great question. I'll start, and then I know Supervisor Barger will give us a lot of wise counsel on sort of how to make sure that we recognize the importance that, you know, we're one country, we're really one world, and if nothing else, this virus has taught us about how interconnected we all are. But I do think that this question is good about sort of what are the plans for reopening. And first I want to start with, yes, we are planning for reopening. It's really important for all of us to know that, you know, we know we're going to get to the other side of this, and we know that we're going to have a return to more normalcy in our lives and the ability to actually be able to be with more other people. I do think it's going to be a gradual lifting of restrictions. I don't see us in any way, shape, or form, based on all of the experience we have from other countries, of being able to just go from where we are today to going back to how it was. I think it'll take many months for us to get back to how it was, and some of that really depends on the development of therapeutics that will help keep people out of the hospital or have people recover faster if they're ill, and the development of a vaccine, which allows us all to have much more protection from a new virus. But I do know that we should start being able to get people back to work. We should start being able to have people be able to congregate with some people that are not in their households at some point in the future. I just am not sure what date that is. But we are planning for what reopening looks like and what is a way to reasonably manage the fact that since none of us have this virus, we haven't seen it before unless we've been infected already, we'll have to go slow at you know, sort of relaxing all of the distancing requirements that are in place today.
And on the second question, William, I will say that public health has driven everything that we've done at the local level as it relates to the orders that are in place. And we've worked closely with both Pasadena and Long Beach, who have their own public health, so that we're all on the same page. But more importantly, we've worked with the state, who has been a constant partner as it relates to what decisions are made. So I do favor working with state and the federal prior to lifting any orders, and working with our public health experts, because the last thing I want is to lift it prematurely and then think that we've got it under control, and in fact, we're back to square one. So, you know, I look at the social distancing and what's happening now, and I'm encouraged that people are in fact abiding by this, but I don't want to lift an order prematurely and risk people's lives. So to Dr. Ferrar's point, I think it's important for us to do it, and then, you know, what is our normal going to be? That it remains to be seen. Is it allowing restaurants to only have half capacity? That may be the case, but for me, it's working with our state and federal officials. So we'll take the next question.
And that will come from the line of Claudia Pesciuta. Please state your media.
Hi, Claudia with KNX News Radio. We were told that we would get an update on the LA County Fire Department numbers during the briefing. And also, I see that Sheriff Villanueva apparently was talking about cases in the Sheriff's Department on a local radio station today, saying that 24 deputies have tested positive, 3 are in the ICU, and 394 employees are quarantined. So I'd like to check on those numbers, and then I have a couple of other questions.
Okay, well, give one more question and then we'll answer them. What's your
Okay.
question?
So if you could make that a part of the regular briefings as the head of the board, I would really appreciate it. Also, if Christina Galley could talk about what would be the total number of hospital beds, ICU beds, ventilators available at this time, given what we know about surge capacity at the local hospitals. And then are we seeing, if for Barbara Ferrer, are we seeing any reinfection in LA County?
Okay, so I'm going to take the first, and that is after your question yesterday, and actually I think you asked a lot last week too, I inquired as to why those numbers weren't being put into play. Our fire chief, in fact, does have that, and you heard the sheriff mention it, so we're going to ensure that that is part of the briefing because Dr. Ferrer, in fact, has asked for it. So it's not that we were not hearing you, but we've asked the departments to compile that information so that we can provide that to you. And with that, I'll have Dr. Galley now answer the question as it relates to the total number of beds and ventilators. Dr. Galley?
Yeah, hi. As of this morning, there were 1,408 available medical surgical beds across the county. That's all hospitals, public and private. And there were 258 open and available ICU beds. On top of that, there's approximately 1,010 open and available ventilators. That's within the Department of Health Services, as well as all the private hospitals. There's an additional 150 ventilators in the EMS stockpile that are available for distribution to hospitals should they need them, and those are distributed only on a as-needed basis. On top of that, there's an additional 170 ventilators that are still currently being refurbished. The Department of Health Services also has an order out for additional ventilators, and those we anticipate coming in at the level of a couple hundred more over the next week or so. On top of that ICU bed capacity, that includes just the general acute care hospitals in the county. So there's also the Mercy Ship, there's also the planned beds that will come online at the LA Surge Hospital, which we announced yesterday. And to that, I'm grateful for the work of our partners, Dignity Health and Kaiser Permanente, as well as the support of the state and the county. And that will bring on additional beds, which includes ICU bed capacity on top of that. Finally, on top of those numbers, all of the hospitals, including DHS, but not just limited to DHS, are working on adding in more ICU beds, including ventilator capacity and medical surgical beds, over and beyond their licensed bed numbers. And we'll be able to share more detail about the quantifying those numbers in the near future.
Thanks, Claudia. We don't have any known case of a reinfection, but I do want to note that we, like other researchers and scientists, really need to be able to do more testing in order to actually understand issues related to reinfections. But we don't have a known case at this point.
We'll do the last question, please.
Okay, comes from the line of Annabelle Munoz. Please state your media outlet.
BC7 here. One question is in regards to the numbers that you mentioned at LA County jails. At this moment, considering the shift in CDC guidelines with face coverings, are you issuing any guidance on whether or not people who are currently in jails, incarcerated people, can and should be wearing face coverings? And then the second question is for the data that you're collecting on deaths so far, is the LA County coroner being equipped with tests to be able to conduct those and include them in your data?
Yeah, on the second question, yes, we work very closely with the coroner, Dr. Lucas, and he is able to test, after someone passes away, if it seems like it's indicated, to determine whether or not that person may have passed away and been COVID-19 positive. So yes, and we work very closely, and any people that are identified after they passed away as being COVID-19 are in fact included in our deaths when we report them out. In terms of the recommendations on cloth face coverings in institutional settings, we actually have submitted a question back up to the Centers for Disease Control to sort of help with the guidance on that and really allow us to, again, benefit from some of the research around when this makes sense in an institutional setting and when it may not make sense in an institutional setting. I just want to remind all of us that the reason that you put on a cloth face covering is to protect others from your respiratory droplets. It doesn't really offer you a lot of protection from others, although if everybody is wearing one, then we absolutely are protecting each other. The issue is that we need to establish that that would be an effective strategy in situations where people are living in congregate facilities, and that would apply for other congregate settings as well. I don't know, Christine, I would ask Dr. Galley, who runs correctional health.
Hi, it's an important and really timely question. Thanks for raising it. At present, we haven't yet implemented that particular change in the jails for the Correctional Health Services Division, as well as in the Juvenile Justice Division. It's something that we're actively looking at. This guidance, as you know, has been changing every day. We are, as Dr. Ferrer mentioned, seeking consultation with federal and state, as well as our local public health departments on this. We've also pulled in an infection control expert with unique expertise in this area to help advise us on what to put in place in the jails. It's, as you can, I'm sure, recognize, it's a very unique environment, and we want to make sure that what we put in place is both effective and able to be implemented for the health and safety of all of the people in the jail, staff and inmates alike. With that, we'll shift over to the Spanish portion of this. Thank you very much.
Buenas tardes, soy la supervisora Hilda Solis, representando el Condado de Los Ángeles en el primer distrito. Antes que empezar, quiero dar las gracias a todos que están apoyando y ayudando a los residentes del Condado de Los Ángeles, especialmente los doctores, las enfermeras y todos los empleados del condado que nos están ayudando en este momento. Quiero hablar de los estacionamientos de las pruebas. El Centro de Pruebas Móvil de Coronavirus en Pomona abrió la semana pasada y puede probar hasta 250 personas por día, 7 días cada semana. Estoy feliz de anunciar que otro centro de pruebas va a abrir mañana en el Colegio del Este de Los Ángeles. Las pruebas también van a ser gratis para todos. Residentes elegibles para recibir pruebas son personas mayores y con condiciones como diabetes, enfermedades del corazón y hipertensión. Por favor, llama a 211 para determinar si usted es elegible para un examen y hacer una cita. Esta semana espero finalizar nuestra asociación con Altamed para aumentar la capacidad de pruebas en sus clínicas en Southgate, Commerce, Pico Rivera y West Covina. Esta asociación nos ayudará a aumentar la capacidad de pruebas en las áreas del sureste de Los Ángeles, el Valle de San Gabriel y también en el este de Los Ángeles. También me preocupan los informes que muestran disparidades raciales en casos y muertos del coronavirus. Necesitamos mejores datos para identificar y reducir disparidades dentro del condado de Los Ángeles. También quiero hablar de que es importante, como las pruebas de la capacidad en nuestros hospitales. El gobernador Gavin Newsom anunció ayer la transformación del Centro Médico St. Vincent para tratar a las personas infectadas con coronavirus, con más de 250 camas. Bajo mi dirección, nuestro Departamento de Servicios de Salud va a apoyar la instalación de este hospital. Por último, quiero decir que hay asistencia de alimentos para nuestras familias en estos tiempos muy difíciles. Por eso quiero decir que también vamos a dispensar comida móvil en Pomona Fairplex y estamos buscando establecer otros centros de despensas de comida en el región. Por favor, visita la página del web lafoodbank.com para encontrar más despensas de comida cerca de donde usted vive. El departamento de WEDAX del condado también está ofreciendo comidas a las personas de tercera edad. Para más información, llame a 1-800-510-2020. Mientras hay señales que las medidas de distancia física están dando resultados buenos, necesitamos hacer mucho más para bajar la curva. Así que muchos quieren celebrar las fiestas religiosas con familia y amigos esta semana, pero no es lo que necesitamos hacer en este momento. Necesitamos que se queden en la casa y evitar a salir. El virus no descansa. Hay muchas formas alternativas para celebrar nuestras tradiciones, a nuestros queridos y a nuestras comunidades. Y la tecnología sería nuestro vehículo para hacerlo. Muchas gracias. Y en este momento quiero introducir a la directora Barbara Ferrer, representando el Departamento de Salud. Y que pasen bien Semana Santa.
Muchas gracias, Supervisora Solis y a Supervisora Barger y a todos nuestros colegas en todo el condado. Esta colaboración en este tiempo ha sido la fuerza más importante que tenemos para de veramente llegar al otro lado. Déjame decirlo así, llegar al otro lado, que todos nosotros queramos llegar al otro lado en este momento. Quiero actualizarlo sobre nuestro estado de hoy. Estamos tristes de reportar 22 muertes adicionales. 16 de estas personas que murieron tenían más de 65 años y todas las personas mayores de 65 años tenían condiciones delicadas de salud. Las otras 6 personas que fallecieron tenían entre 41 y 65 años. 5 de estas personas tenían problemas delicados de salud. Esto eleva el número total de muertes a 179 en el condado de Los Ángeles y nuestra tasa de mortalidad para COVID-19 es del 2.4%. Muchas personas en nuestra comunidad están lamentando la pérdida de un ser querido por COVID-19. Estamos de luto con ustedes, lamentamos profundamente su pena y nuestros pensamientos y oraciones están con ustedes. Hoy también estamos reportando 550 nuevos casos. En las últimas 48 horas ha habido 960 casos nuevos. Hay 6,910 casos totales en el condado de Los Ángeles. El 78% de todos los casos positivos ocurrieron en personas entre las edades de 18 y 75 años. Este número se ha mantenido constante en todo momento. 1,510 casos han sido en algún momento hospitalizados. el 22% de todos los casos positivos. Puede ver el informe actualizado de los casos del Condado de Los Ángeles en el sitio web del Departamento de Salud en publichealth.lacounty.gov. Actualmente estamos investigando 121 entornos institucionales con al menos un caso confirmado de COVID-19. Estos incluyen hogares de ancianos, instalaciones de viviendas asistidas, refugios, centros de tratamiento, viviendas de apoyo y instalaciones correccionales. El total de casos confirmados en entornos institucionales es de 552, incluidos tanto el personal como los residentes. Los 307 de estos casos confirmados son residentes y los 309 son empleados. Lamentamos informar que 37 personas han muerto por COVID-19 en estos entornos. Estos incluyen enfermería especializada, vida asistida y entornos correccionales. Hasta el día de ayer, más de 35,300 personas han sido evaluados en el Condado de Los Ángeles y el 14% fueron positivos. Muchas gracias a todos ustedes con su paciencia para buscar los lugares donde se pueden tratar de hacer las pruebas. Y muchas gracias a la supervisora por llegar a otros sitios, para traer otros sitios en los vecinarios donde nosotros vivimos. Quiero terminar a pedirle que por favor se queden en la casa y se mantengan seguro y saludable en la casa. Yo sé que muchas personas se sientan ansiosas y deprimidas en este momento. Estos son tiempos sin precedentes y es fácil sentirse abrumado. Pero quiero decirle que hay sitios donde puedes buscar ayuda. Si se siente abrumada o estresada y desea hablar con alguien, puede llamar a la línea de ayuda de 24 horas los 7 días de la semana del Centro de Acceso del Departamento de Salud Mental del Condado de Los Ángeles. Este número es 800-854-771. Y para aquellos de ustedes que están experimentando violencia doméstica o amenaza de violencia doméstica en su hogar, hay ayuda disponible. Los servicios de violencia doméstica del Condado de Los Ángeles siguen disponibles y los refugios están abiertos y aceptan entradas. Puedes llamar a la línea directa de violencia doméstica. Ese número es el 1-800-978-3600. Y también hay recursos en el sitio web del Consejo de Violencia Doméstica. Eso es en publichealth.lacounty.gov DV Council. Esta semana es la Semana Santa y la Pascua comienza mañana. En este momento que muchos de nosotros queremos estar con familia y con nuestras comunidades de fe, yo sé que el tiempo es bien difícil, pero muchas organizaciones basadas en la fe están encontrando formas de llegar a las personas de línea a través de servicios virtuales y las personas están encontrando formas de practicar su fe juntos, desde lejos. Muchas gracias por todo que están haciendo para que podamos estar aquí seguros y en los hogares, pero con la fe intacto y celebrando esta semana especial. Ahora vamos a comenzar con preguntas. But now we're going to take questions.
Okay. Our question comes from the line of Raymond Mesa. Please state your media outlet.
Doctora Ferrer, Raymond Mesa de Telemundo 52. La pregunta es esta. Usted mencionó anteriormente el porcentaje de acuerdo a la etnicidad. ¿Me puede repetir esos datos en español y por qué el 28% de latinos, cuáles eran sus edades, sus trabajos y cualquier otra información pertinente de por qué ese porcentaje es tan alto para los latinos.
Muchas gracias por la pregunta. Ese reporte, vamos a tener más detalles la semana que viene, esto que tengo en este momento, pero el 28% no es tan alto porque 50% de las personas que viven aquí en el condado de Los Ángeles son latinos. Se parece que es mucho porque cada morida es mucho para todos nosotros, pero de veramente como que somos 50% de las gentes que vivimos aquí, el 28% no es tan alto. Pero tenemos que hacer más pruebas para entender este dato, porque todavía no tenemos datos sobre todas las personas que han morido de COVID-19. Muchas gracias por la pregunta. La próxima pregunta. No quedan más preguntas, muchas gracias a todos. Nos vemos mañana. Gracias. Thank you very much. This closes out the press briefing for today. We'll see you tomorrow.
Okay, ladies and gentlemen, that does conclude today's conference. I want to thank you